I'm Dr. Suvarchala, Scientific Director with ZIVA Fertility Centers. So what increases the infertility rate in males? Basically, what are the causes that increase the chance of not being able to achieve fatherhood? The first and the foremost thing that we need to discuss is age. Definitely age is not a major factor when it comes to male infertility. In females, yes, age plays the most crucial role. Once they cross 30-35, they decline in the quality of the egg starts. Therefore, it's very, very critical for females to consider age before considering postponement of fertility. So in men, age basically plays an important role is when they cross 40-45. So at that time, the sperm production is a little affected due to hormone balance and hormone release from the brain, etc. So what happens basically is that there is a little bit of DNA damage or increase in DNA fragmentation, which is called as, in the sperms, the DNA from the father is packed. So any fragmentation, any breaks in the code in this occurs basically if it is related to age from the age of 45. So age does play an important role in men also, and it starts a little late, probably 40-45. But it's also aggravated due to other factors that we'll discuss. Being overweight or obese is another very big problem which causes DNA damage inside sperms. So the quality of sperm, basically it could be the count, it could be motility, or it could be also be the morphology, the way the sperms look also is basically affected by being overweight. Now what happens is not just being overweight, it's also complicated when it is related with diabetes. So in diabetes also, because there is an imbalance of proper metabolism, proper release of hormones from the brain to the testicular area, all these things affect the production of sperms, and not only that, they also affect the quality of sperms that are produced. So obesity plays a very important role in male infertility. Another very big factor is smoking. So smoking, there's been a lot of studies all over the world if smoking is really affecting sperm. So yes, it does affect sperms. The nicotine, the other harmful particles which are present in tobacco basically are hampering the quality of sperms and the quantity of sperms. So heavy smokers were compared with non-smokers, and numerous studies have shown that smoking definitely affects the quantity and the quality of the sperms. Now what happens is, when sperms are produced in the testis and travel that long journey towards ejaculation, they are traveling and being stored in different parts of the reproductive system. So at every stage they are exposed to these harmful chemicals which are produced, which are accumulated in the body from smoking, which is why the sperms are affected. Not only the sperms, the semen is also affected. Therefore, since we know that semen is then the nutrition for sperms, these sperms are then affected because they are surrounded by those kind of chemicals. So smoking does play an important role. Exposure to testosterone is also a very important factor. This usually happens when people are, looking at increasing their muscles, bodybuilders, people who are are very keen on fitness and want to increase their muscles, include these, testosterone loaded maybe drinks or drugs or all these things. These definitely have an implication on sperm production. So drugs or exposure to testosterone also plays an important role. Another important factor that we are all aware of right now is environmental exposure. So exposure to pollutants, exposure to all the harmful chemicals in the pesticides, the food that we consume, also are known with the fact that they bring down the sperm count and general quality of the sperm. Also, a very important factor that we need to discuss is that sperm quality and quantity is severely affected in people who, so to say, have a sedentary lifestyle. If you consider the sperm quality between someone who is very active and sperm quality between someone who is sitting for a very long time, maybe their profession demands it or they are prone to such a lifestyle, their sperms and the sperms from an active person are also entirely different from each other. So people who are prone to prolonged sitting have a prolonged exposure in the testicular area to increased temperature. So when temperature is increased, sperm production decreases, because sperm production usually occurs and is maintained at 35 degrees centigrade. If the temperature is increased, then this quality and quantity is definitely affected. So people who are prone to sit too long, like a software employee or maybe a shopkeeper or someone who's driving around the whole day, these professions, the comparative analysis has done and shown that sperms are definitely affected. Other things such as exposure to radiation, exposure to chemicals also plays a very important role. In case you want to understand why your semen analysis report is low and you want to understand it from your history point of view, what have you been exposed to, what have you, what surgery have you undergone. If you would like to get a second opinion and understand more about your report, please feel free to contact us on the following numbers. Thank you.